Hi everyone, and welcome to another episode of the Afya Health and Lifestyle Interview Series from the Agbari Multimedia Company. At Afya, we'll be inviting well-seasoned health specialists to educate you on the causes and prevention of certain diseases, shed light on some of the myths and misconceptions you must have heard about these medical conditions, and equip you with practicable tips for attaining good health. If you're a first-time viewer, welcome to the Agbari channel. We hope to see you around more often. And to our returning subscribers, it's great to have you here again. Great to have you on the show. Thank you for watching. Thank you for sticking by. And don't forget to like, share, and comment. You can also drop your comments, your questions in the comment section. Now, today, our guest will be talking on an oral condition. And I know that a good number of people, a good number of us, we don't pay attention to oral hygiene as much as we should. We just wake up, we just brush maybe once a day, and then that's all the care we give to our mouth. But it shouldn't be so. So we urge you to listen attentively on today's episode and pick up one or two things on the devices, bleeding gums, oral healthcare in general. Taking us on this journey of enlightenment today is Dr. Kende Umeizudike. But before I bring her on stage, let's get to know her a bit.
Dr. Kende Adeshola Umeizudike hails from Ogun State and completed her secondary school education in 1988 at the Federal Government Girls College, Shagamu, Ogun State, after which she proceeded to obtain a university degree, Bachelor of Dental Surgery in 1997 from the University of Ibadan, Oyo State. She completed residency training in 2008 at the Lagos University Teaching Hospital, Idiaraba, and obtained a Masters of Public Health in 2014 at the University of Lagos. Currently, Dr. Kende is an Associate Professor of Periodontology in the Faculty of Dental Sciences, College of Medicine, University of Lagos, a board member of the Faculty of Dental Surgery of the National Postgraduate Medical College of Nigeria 2021, an editorial board member of the Nigerian Journal of Periodontal Research from 2020 till date, a journal reviewer, and has collaborated with researchers locally and internationally, having at least 50 publications in peer-reviewed journals. She's married to Dr. Theophilus Umeizudike, consultant, nephrologist, and transplant physician at the Lagos State University Teaching Hospital, Ikeja. Blessed with two lovely children, and in her free time enjoys teaching, watching movies, dancing, making beads, helping, inspiring, and motivating people.
Yeah. Hi, Dr. Kende. Good morning, ma.
Good morning, Kende. How are you today?
Fine, thank you, ma. It's great to have you on the show.
It's a pleasure to be on your show. Thank
Yes.
you for
Thank
having
you
me.
very much, ma. Yes, I trust the day is going fine.
Yeah, so far the weather is good, so it's a good day.
Oh, thank you for that. So let's get to the interview. Today we're talking about oral health and devices and swollen gums. But yeah, I want us to first of ease into it slowly. What is gingivitis? What part of the body is the gums? I'm sure I don't know, but some people might even be asking that. So like a basic introduction into what the oral side, and we'll now go deeper into gingivitis and bleeding gums.
Okay, so let's start with the gum. The
Okay.
gum, and everybody has gum or the gingiva. It is that pink part of the mouth that surrounds the tooth or teeth. So when you smile, like I'm smiling now, that pink part,
Okay.
that is the gum. It forms part of the supporting tissues of the teeth. There are other supporting tissues, but the gum is the most superficial one, and it protects the underlying, the deeper tissues from injury, from bacteria, from germs. And that's one of its functions, is protective. And in people that are black, like we in Africa, and also people of Asian origin, it's pigmented. It's not just pink. It can also be pigmented with melanin, and which imparts a dark color. So some people have dark, gums, but it depends again on the intensity of the pigmentation. Some people have more of it, while some people have less of it. In Caucasians, they don't have so much of that. They really do not. They are white, they are light skinned. So
Mhm.
it's more in blacks. So that's what the gum is. And in health, the gum is pink in color. And if you talk about gingivitis, which you asked me about, gingivitis just means inflammation of the gums. And when we talk about inflammation, it's a pathologic process, it's a disease process. whereby the gums, they become inflamed due to some injury. It could be due to bacterial insult or from germs. It could be from viruses. It could be from fungal organisms also. All these can damage the gums and cause inflammation. It could even be from other things, agents, like it could be chemical agents. It could be trauma, injury also, maybe from a mechanical agent or an object. It will also cause inflammation. And when it's inflamed, certain things happen. The color changes as well as other things.
Okay, thank you very much for that answer, Ma. Yeah, I feel like now
Thank you.
people are more familiar with what gingivitis is. I think I myself, there was a time I had, like my gum was really swollen, and I did not even know how much of a big deal it was until I had, that's when I now had to go search for it and Google it, and then I could not sleep, I could not eat properly, it was terrible.
Wow.
And there's some, I don't know, I wanted to clear some misconceptions. Like during the time I had it, some people were saying, okay, salt and water, warm salt and water, then gargle every morning, morning, like morning, afternoon, night, stuff like that. They get all sorts of
Advice.
treatment advice. Yes, yes. I want to just like help us educate the public. What in a case where you have the following government advices, what are necessary steps to take, and what should we not take?
Okay, maybe I should just quickly say this. Now, gingivitis, I said one of the symptoms um,
Okay.
is in fact the most common symptom is bleeding from the gums, which
Mhm.
you rightly said. And the bleeding can be during brushing, when brushing, and many people find that, well, and they think it's normal. Some even think it's due to injury from the toothbrush. But when there is
Okay.
bleeding from the gums, commonly is due to gingivitis or maybe the more advanced stage, which is periodontitis. But we're talking about gingivitis today. The other symptoms they may feel, they may have some puffiness of the gums. It
Mhm.
will be swollen, just like what you said, or it could even be red. Now, the redness may not be so pronounced. It may be in the severe forms that is actually red. And most people don't pay attention like that, and appreciate that red color. They could also have discomfort. They could also have bad breath. So these are some of the common things they could have. But the other thing that's important that people should note in addition to gingivitis is that there will be poor hygiene, because that's what causes most gingivitis, poor hygiene from plaque deposits, tooth deposits. So if you look in the mirror, they will notice some creamish, yellowish deposits on the tooth closely adjacent to the gums themselves, and they are soft and they are bacteria containing. Now, if they are not removed frequently on time, which will take me to the next question that you mentioned, they become hardened to form calculus or tartar, which cannot be removed by brushing. Okay, so now to what you asked. Now, fortunately, gingivitis is preventable. It's easily preventable. It's one of the most preventable diseases, I must say. And how do you prevent it? By brushing effectively. Most people brush, but most people don't brush effectively. They don't brush for adequate duration of time, and they don't even use the right method to brush. So you brush. I will talk about that later on. Brushing and then using floss, dental floss, to remove plaque from in between the teeth, because the toothbrush might not gain adequate access in between the teeth. And this is really the point where the inflammation starts from in between the teeth. It's sheltered away from friction of the tongue, the cheek, and things like that. And in terms of warm water and salt, so the warm water and salt can actually be used. It helps, encourages healing. The warmness increases blood flow, blood supply to the region of the gums, and the increased blood flow carries oxygen, which is important for healing, and other nutrients that it brings, healing of the tissues, the gingival tissue. So it's all right if you have to do warm water and salt, but of course it has to be recommended, it has to be prescribed, the warm water and salt. So it's important to do that.
Okay, thank you very much, Mark. So it seems like there was some truth to what I heard.
Yeah, some truths. But you know what? What happens is that sometimes um people are used to just giving that prescription one more time so for anything. Somebody has to
Oh,
decay. They don't even know what it is. They just say your tooth is paining you, use warm water and salt. So it's not a it's not a prescription for any and everything. There are
okay.
indications for warm water and salt, mouth rinse or mouthwash.
Okay, okay. So it's not like it's a generic solution. It's not.
No, it's not. But we
Warm
usually
water.
prescribe for a number of things in dentistry, really,
Oh,
particularly
okay.
maybe following an extraction, following a gum surgery or an
Okay.
oral surgery, because it has to do with healing, facilitating healing of the tissues. So, or even an ulcer, of
Okay.
the tissues, we can also prescribe one more time. So, and also mouthwashes. There are some
Oh,
mouthwashes that are antibacterial that really have been proven to be more effective. So, in the absence of that, we can prescribe warm water and salt, or sometimes we
okay.
prescribe both of them together concurrently in an alternate manner.
Okay, so you use one, then use the next. You combine the
Yes,
two. Oh, okay,
exactly.
okay. Thank you for that. Okay, so my next question would be, what are the complications that could arise from gingivitis, or other besides
Okay,
the fact that gum is bleeding and,
okay.
and pain? What other complications? What complications and maybe the symptoms it gives?
Okay, so gingivitis, like I said, is the early stage in biofilm or plaque-induced gum disease. Now, if it's
Oh,
not treated, it could progress to periodontitis. Periodontitis is the inflammation of the gums as well as the other supporting tissues that I mentioned earlier, like the ligaments, like the bone, like the cementum. So the infection goes deeper into the tissue. And what it means is that the bacteria, they release some enzymes, some toxins, which destroy the tissues. Of course, the body tries to fight back, and the white blood cells will be mobilized to fight, and they will succeed to some extent. However, sometimes they also cause some collateral damage even to the
no.
tissues. And so when this occurs, we have what we call bone loss. And bone loss means the height of the bone, for instance, that should really, be to a certain extent covering the root of the tooth, that height is reduced. The ligaments that attach the tooth to the bone, they are also destroyed, some of them. And with
Oh,
time, what happens is that the patient begins to present with pockets. Pockets are like spaces between the tooth and the gum. Normally, we have those spaces there, but in periodontitis, they become deeper. And so you can have food packing. So some patients will complain of food packing, meat getting stuck, excessively between the teeth. They could also present with, of course, gingivitis, bleeding gums. They could also present with bad breath, what we call halitosis, because you have food packing in between, and some of them get broken down. And if the bacteria also break down this food, they will produce some, we call it or we'll call it some sulfur containing compounds are released, like hydrogen disulfide and all that. And so you find that there begins to be some mouth odor. Also, with
oh,
time, the tooth becomes loose and it starts, becoming shaky. And if nothing is done, it could actually fall off because the support becomes more compromised. Sometimes they
no.
present with long roots. I mean, that means long crowns because there's receding of the gums. We call it gum recession. So the
No.
tooth crown appears longer. And of course, why is appearing longer means part of the support is damaged also. And all these can ultimately affect aesthetics. In fact, with time, we have what we call pathologic migration. I'm not using big terminologies, but it's like when you have emigration, but now the teeth begin to shift their position because the bone that surrounds them and supports them is compromised. And so you start having some malalignment, malocclusion. Do you understand? Some would tell you that I had this tiny space before. Now the space has become wider. The tooth crown even begins to come out as though the tooth is going to fall out. These are the advanced stages of periodontitis, and it affects chewing ability, mastication. When the teeth are loose and mobile, patient cannot eat very well. It affects esteem, self-esteem, and it goes on and on. These are some of the complications. Yes.
Okay. Thank you very much for that, Ma. Thank you for that, Ma. I believe that there are some slides that can better show us some of these conditions you've mentioned.
Yes. For instance, okay, this slide is healthy gingiva. So you can see how the gums are well contoured around the neck of the teeth, and they look really healthy. Like I told you, they are pink, but because of the pigmentation, melanin pigmentation, it appears dark. Some areas are dark, and you can see it's well contoured. It looks firm. There's no swelling. We cannot see bleeding. We can't even see deposits, poor hygiene. Everything is healthy. So this is what we expect a healthy gingiva to look like. Now, the next slide will show bacterial plaque that I've been talking about. Biofilm. We also refer to it as biofilm deposits. They contain bacteria, and you can see them surrounding the teeth, and they're actually adjacent to the gum. And with time, they begin to cause inflammation and redness and bleeding of the gingiva. Now, if nothing is done to this plaque, if it's not removed effectively by your brushing properly, then the plaque calcifies to form calculus, which is the next slide. Yes, it's also known as tartar. Now, these are hardened dental plaque or biofilm. This cannot be removed by brushing. We have cases where patients sometimes, or even at home, individuals will attempt to remove this because it causes some form of disfigurement, so to say, to their appearance. So they use pins. Some use forks. Some have even tried to use knives to scale them off. And that is wrong because it could cause damage. It would likely cause damage to the gum and even the cheek, the lip. So we don't encourage that. This is what the dentist removes with their instruments. We have specialized instruments that are used to remove this in the dental clinic. Now, the calculus and the plaque together constitute the poor hygiene, along with some food debris. You can already see the gingiva, the gum, already, if you can appreciate, is already getting swollen, and engorged. You can see, yes, it's already swollen. Now, if nothing is done, if we look at the next slide, we realize that it becomes, gingivitis. And I'm sure you can appreciate, yes, the deposits are there. You can see the redness and then the irregular shape of the gum margin. I'm sure you can appreciate that. And this will bleed. It becomes soft. There can be bad breath, halitosis, and it can cause some embarrassment to some people. And in addition, sometimes we could even have stains on the teeth, particularly those that take a lot of coffee, drinks and beverages like that. They could stain the teeth, or things like bitter cola, they could stain the teeth, or people that take concussions, a lot, some of them can stain the teeth. If you move to the next slide, okay, so you can appreciate this now. In fact, you can see the redness and it tends to bleed. I'm sure this will bleed. You can see some areas that are bleeding. This is severe form of gum disease, severe gingivitis. You can still see the deposits. Now, what happens is that what we call false pocketing forms, which means the gum is swollen and enlarged and covering part of the crown of the teeth. And this will encourage more debris to pack under the gum. And this becomes even difficult to remove. The situation we have is that when people have this situation or scenario, because of the bleeding, they even stop brushing effectively. Some of them resort to cotton wool or gauze, to clean their teeth because they are afraid of the bleeding. But whereas they are afraid that the gums will bleed. And the challenge is that when they stop brushing, it's a vicious cycle. You have more plaque buildup, more swelling, more bleeding, and at the end of the day, it could get worse. So before it gets to this stage, we want people to come to the clinic so we can intervene professionally.
Thank you very much for that, man. That was very insightful. That was like we already
Okay.
have a clear picture of the devices and some of the complications that could occur.
Okay. Yes.
And so
Yes.
the next question would be the predisposing factors. What predisposes an individual more to device, or what increases the risk of? I know you already mentioned some things like poor oral hygiene,
Okay. Yes. Yes.
but I want you to touch a bit more on it, on the
Okay.
predisposing factors.
Okay. Now, the commonest predisposing factor is poor hygiene, like I mentioned. But there are other
Yeah.
factors that could encourage that poor hygiene. For instance, people that
Okay.
have malaligned teeth, when there's
Mm.
malocclusion, whereby you have crowded teeth, when there's some crowding. And there was a slide there that actually showed, um, you can see the diagram on the left. What's written there is crowding. You can see some of the teeth are overlapping one another. You understand? And when they're overlapping like that, it means it will not be easy for the individual to clean them properly. They are not well aligned. And this can encourage food packing in between. It can encourage plaque, more plaque to build up, or even calculus. So this is one of the factors. The other factor is that sometimes, fortunately, we can carry out some treatments like braces to
Okay.
correct this, as you can see on the right. So this is an orthodontic appliance, a fixed orthodontic appliance, which is meant to help to correct the crowded teeth, which is good, which we encourage. However, this also can be a predisposing factor if it's not cleaned properly. All those metal components, the wires, the brackets, they can be a source of plaque formation and accumulation. And this also can encourage gingivitis. So it's important that patients can brush, should clean these appliances very well, and their teeth rather, when they have these appliances on. Other factors that could encourage plaque formation and gingivitis could even be people that have some fillings, restorations. If they are not done properly, the crowns and things like that, it can encourage plaque formation. And once you have plaque, it could predispose to gingivitis. Then mouth breathing. There are people that are mouth breathers. Maybe they have some maybe adenoid, some nasal obstruction. So you find that they breathe a lot. Even children, you find that common in children, and teenagers. So when they breathe with their mouth, it dries faster because the
No.
saliva that should have some protection is, it's not there in the adequate amount, and that can lead to plaque retention, which could predispose to gingivitis. These are just some among many. Then, sorry, some systemic conditions too,
Okay.
like people that hormonal changes, for instance, puberty,
Oh,
pregnancy, diabetes, things like that. Those hormones will kind of encourage um, an exaggerated response. So the plaque will
no.
be present, but it makes the individual respond excessively. So they have more inflammation to those deposits. Those are
No.
some
Okay.
predisposing factors.
Oh,
Thank you.
okay. Okay. Thank you very much for that, Mark. Thank you for that. So, I want to talk a bit on the oral hygiene part. Like, so how do we properly care for our mouth?
Okay.
What are the yes, yes, some things
Yes.
in the
Yes. It's important for us, before I just say that, for us to care for our mouths properly. Huh?
yes.
I'm not trying to take us back. You mentioned the complications. There was one I didn't really mention.
Okay.
Periodontitis, now this is a topical issue, has been found to be related or to worsen some systemic conditions. And that is a major complication, like cardiovascular disease, like poor pregnancy outcome, low birth weight baby, or even
Okay.
glycemic control, poor sugar control. So it's important for us to maintain good oral hygiene to prevent gingivitis, so it does not progress to periodontitis, so it does not even progress to have systemic adverse effects. So how do we how do we maintain good oral hygiene?
Yeah.
One way is to control the plaque. And how do we control dental bacterial plaque? Is by brushing effectively. Twice daily toothbrushing with a medium textured toothbrush, using the
Okay.
right technique. There are different techniques, but the ones we encourage are the BAS technique, or the modified BAS technique, or the roll technique, which is easier. And that would help. Using fluoride containing toothpaste, any toothpaste, but that contains fluoride is important.
Okay,
And this must be done in the morning and last thing at night before going to bed. The other thing is the dental floss, which I'd mentioned, which is important for cleaning in between the teeth. So floss is recommended. Then I think then we have interdental brushes. There's another slide. Yes. Now interdental brushes are not common, in this environment, but they're available really. Now sometimes some people have some spaces between their teeth more than others. The floss may be used, but the interdental brushes may even be better. And they are like bottle brushes, tiny brushes that you pass in between the teeth like this, and then they are used also to remove the plaque. Now, like I said, gingivitis can be prevented by the individual, by all what I've mentioned. But we must understand that it's important for people to visit their dentist regularly. We recommend every 6 months. But again, it should be tailored to the individual. For some, it might be every 3 months. For some, it might be once a year. But generally, we recommend every 6 months. And when you come for that checkup, not just when the individual has pain, because many of these diseases, gingivitis, for instance, it is usually painless. Even periodontitis at the early stage. So you find that most people don't even know there's a problem going on. And by the time they realize there's a problem, it's usually late, too late to save the teeth. And so you must visit your dentist, whether you have pain or not, for checkup. Now, when you get there and you have gingivitis, some plaque and calculus deposit, they will carry out professional treatment, what we call scaling and polishing. You understand? And it's the scaling that will remove the plaque, and the calculus, like I said, that you can't remove by any instrument at home. And then sometimes we do some other treatments like gum treatment, like root planing, curettage. There are other things we can do in addition to surgical treatment when it has gone beyond this simple scaling and polishing. And then you are taught how to brush the teeth.
Thank you very much for your answer, Ma. So I would like you to give our audience a roundup on today's on the devices on tooth care. Just a take home message for them to dote on from all of this. Yes, Ma.
Okay. Thank you so much for having me. Health is wealth, we say. Gingival or gum health is gum wealth, and also systemic health. And so take care of your gums, brush your teeth twice daily, use interdental floss, or interdental brushes to clean in between your teeth. Pay attention and visit your dentist regularly every 6 months, and verify information from professionals, not from friends, or family members. Visit the professionals who can tell you what the problem is, because no two individual is the same. So what applies to someone may be different from what applies to you. And remember that because the mouth is the gateway to the body, the health of your gums will ultimately impact on the health of your body. So that's my advice to you.
Okay. Thank you very much, Ma. Thank you for all the information you've given us. I think I feel like I've heard it. And now I even know that the people that advised me that time may have been right on the salt and water thing.
Yes.
It was great having you here. So, and we've gotten to the end of today's episode. And on behalf of the management of the Agbari Multimedia team, we want to say thank you for your time and lending us your expertise, Dr. Kennedy.
It's a pleasure. Thank you so much for having me. I'm happy. Thank you.
Welcome. Yes, so the Agbari Multimedia family out there, thank you for watching. I hope you picked up some facts and actionable tips. And remember that you can drop your questions in the comment section, and we'll be sure to hand them over to Dr. Kennedy and get them answered on your behalf. Don't forget to like, subscribe, and share the video with your loved ones. Till we see you again next time, stay healthy, brushing and flossing. Bye.
Bye.